Good.
Hello, everyone. How many have we got in the room?
9 of us, I think.
Yeah.
9 of us. Okay, I'm guessing that's how many we're meant to have. So my name's Sarah Mills. I'm Locality Development Manager for Castleford and Watchwood CCG, and Kelly and Sarah have invited me to facilitate this session. There's a slide deck that I will go through. Does everybody know each other in this space? Do we want to do a quick round of introductions? I know that we've all said hello earlier, but just so that we know who's round the table, as it were. Would that make sense? So I just need to find my participants. Shall we start with Julie Sawford?
Yeah, hello everybody. Yeah, my name's Julie Sawford. I'm a family and community worker at the Mega Centre, and I've worked with Scott with the Community Response Hub over the last few months.
Brilliant, Julie. Thank you. Ben?
Hello, Ben Brook, Castle Point Borough Council Strategy, Policy and Performance Manager.
Thanks, Ben. Caroline?
Hi everyone, Acting CEO for South East and Central Essex Mind, offering mental health services in Southend, Castle Point and Chelmsford.
Thanks, Caroline. Lindsay?
Hello, I'm Lindsay Gillingham, Head of Operations at CABS.
Thanks, Lindsay. Victoria?
Hi, I'm Victoria Marzuki, and I'm the manager at RUBS.
Thanks, Victoria. I've got CEO Mega Centre.
Yeah, I need to change that. I just because when I go to the meetings, I need to change it. I have a name. My name is Scott Williamson. I am the CEO of the Mega Centre. And absolutely, we've been quite key in instrumental in the Community Response Hub for RDC and working in partnership with the people. And obviously head up the Mega Centre in all of our community things that we do.
Thank you. Did you say Carl was your first name?
Scott is my name today.
Scott. I don't know where I got Carl from. I just made that up.
Carl, that's fine, Sarah. But
No, Scott. I'll stick with Scott. Thank you, Scott. Elizabeth.
Hello there. I'm taking the notes today and recording the session from RDC.
Thanks, Elizabeth. And Councillor Webb.
Yeah, hi there. Good morning, Councillor Mike Webb, Community Portfolio Holder for Watchwood Council, and also just changed Scott's name to Scott.
Thanks. Thank you, Councillor Webb.
Sarah.
That's all right.
Yes.
Sarah, it's Victoria. Sarah?
Yeah.
It's Victoria. Can I just apologise? I do have a face, but I haven't got my video on because my little son's running around. So I'm sorry about that, everyone. But it's just safeguarding, that's all. Okay.
That's no problem, Victoria. That is the realities of lockdown life. And we're just glad to have you. We're glad to have your voice here.
I would like to have. We've worked with Elizabeth Lake for the last 6 months, but we've never seen her face. So
oh, she's lovely.
Oh, there she is. Nice to
Yeah.
Lovely.
Thank you.
Right. So I think we've got about 30 minutes for this conversation. So I've got some slides which I'm going to share. I'm not going to go through them and present them, but I think they are a starter for 10 in terms of our conversation. So I will just pop them up if that's okay. So can everybody see my screen?
Yep.
Brilliant. Okay. So we are the Community Resilience Workshop. I think we're all here because we have a vested interest in building and strengthening our communities. And so this is a kind of new priority area, community resilience. And so I think that probably the slide deck for this particular conversation looks a little bit different to the slide decks for other conversations. We have got some data. It's mainly the community hub data. I don't want to spend too much time looking at that really, because I think that we've had a really good update in the main meeting around the kind of amazing work that's been going on across Castle Point and Watchwood from a voluntary perspective throughout COVID. It's pretty humbling to hear what an amazing job everybody's been doing. So it's just to say really, I suppose, that community resilience is becoming a priority area in its own right. It's probably absolutely crucial to the future of the kind of localities and the health and well-being of the population who live in Castle Point and Watchwood. building on some of the work that's already happened as a result of COVID. But I think that historically there's been really good community engagement across Castlepoint and Rochford. And so it's something that we need to formalise in terms of the health and wellbeing offer, and something that we need to work together in partnership to deliver. So just a quick kind of few questions for you to sort of ruminate on whilst looking at the data. What does it tell us? Are there any key themes? And what's the current situation? And what's the future look like in terms of community resilience for Castlepoint and Rochford? So this is the Operation Shield data. They've got the Essex-wide data and Castlepoint and Rochford. I think the key thing for me that comes out of this is just the absolute volume of support that was offered. And obviously, we've got Scott and Julie and Victoria on the call. Are there anything that you want to draw out of the data? Obviously, there's a number of data slides. Shall I flick through them all, and then we can kind of talk about what the meaning might be? Is that helpful?
Yeah.
So these are the breakdown of category A and registered and unregistered users. You can see where they are by ward. Again, that's the same for Rochford, registered and unregistered category A users. Vulnerable residents, again, registered and unregistered. So I think there's that understanding that we know who some of these people are, but we don't know who all of them are. Same for Rochford, registered vulnerable, unregistered vulnerable. Are those unregistered vulnerable people really difficult to find, to help, to offer support to access? And then this is the Essex Welfare Service. So we've got that broken down by Rochford and Castlepoint, and you can see the Essex picture at the top. So that's the very high level overview of data during COVID. Obviously, the data set that we have for community resilience is somewhat limited because it's a new priority area. We don't have that historical collection of data. Also, it's, I think, a much more difficult thing to quantify. Physical health, you can kind of quantify that, who's accessing services, who's accessing what, who's obese. There's kind of lots of data around that. Community resilience is a little bit more intangible, a bit more qualitative, a bit more around perceptions rather than facts. So I'd just like to draw out some of those feelings and thoughts from all of you in response to your experience of the last few months of community and voluntary offer locally. Would anyone like to start? Scott, do you have anything? Does the data look familiar to you?
Yeah, it does look very familiar. And even though the numbers are quite high, I think for me, I think we certainly, obviously I can only speak from a Rochford district rather than Castlepoint, but saying that, we do work in Castlepoint as a mega centre as well, is we presume that we're very, I think one thing that struck me really in all of this is the isolation in our community is phenomenal. And actually the isolation, even though we think we live in a vibrant community where people connect with each other and all the rest of it, I think the isolation was quite evident of people and the vulnerability of people who don't feel able, for whatever reason, to connect in with the services that we have in our community. That would be the thing. For the number of people that were isolating themselves because they just felt that they were not able to connect into the resources in our community, be it healthcare, be it whatever, was quite staggering to me. The amount of people I spoke to, and I've spoken to hundreds over the last 6 months, that was quite telling to me, that we've got fantastic services, but I'm not sure they're aware of all of them, and they don't connect into them, and I would love to know the reasons why that is.
Do you feel like you don't have a sense of why that is then?
I think I do. I think I do, but there might be my perspective
Mm-hmm.
of it. I'd rather work out why their reasons were. I think I have my reasons. Obviously, I'm married to a GP who works in the area as well, and I think I have my perspectives of why I think that is. But that's mine, coming from a very different position than they're coming from.
Yeah.
you know, the older generation, it was like, we don't need it. You know, Julie and I were speaking to 18, 19-year-old people, you know, why us? You know, we don't need that. Give it to us, somebody else, don't give it to us. So I think if I was to share perspectives, I think it'd be my perspectives rather than what they think. And when you actually try to speak to the residents on the phone, which I probably spoke to about, or I probably spoke to about 300, 400 residents in the whole of the last 4 months, not face to face, on the phone, they were very resilient to actually give that input to you in an informal way, which is quite telling as well. I don't know what you think, Julie, you were part of that.
Yeah, no, I agree. I think there is a lot of older people who think, you know, I don't need help. I've managed all this time, and you know, this is fine. Or give the help to somebody else who needs it. And also, people. I did speak to quite a few people and took food parcels to people who almost felt really embarrassed at the thought of having to accept help because they've always managed. And this has obviously hit them quite hard, and you know, like all of us, we all need help at times in different forms, and it's getting that message across as well, that there's nothing wrong with having the help or asking for help.
I think the key thing for us as well, because we worked in partnership, Sarah, I think that was really, 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 really helpful, certainly from RDC point of view, because we had the council, we had the community, we had the churches, we had volunteers, and I think that was really, really powerful, because you had some say, well, I'm an ordained vicar, so I can say this. I don't want the church bringing me anything. What the church ever bloody done for me, sort of thing. Yeah, I had that, and I went, oh, I'm so sorry to hear that. I'm a vicar, but never mind. But because we had a good representation of all those different communities working together, what we had was people who said, well, I don't want to get anything from the church. Well, it's an optional district council thing. Some people say, I don't want anything from the council. Well, it's a community thing. And I think that's really, really helpful. Really, really helpful.
Yeah. So the strength is great. The total offer is greater than the sum of its parts, basically.
Well, 100%. Yeah, and I think that was really helpful from I don't know what council web thinks, but that was really, really powerful from our sense. And you didn't have people sort of say, well, I don't want anything from the council, I don't want anything from the church. But actually, because we were working together, I think we helped a lot more people.
I think part of what you said, and I'm picking up on what you said really, I saw some slides yesterday that Mike Gogarty shared about unemployment data in the county, actually. And what was interesting is that at the start of lockdown, Tendring had a relatively high unemployment level and Rochford didn't. And as we progressed through furlough and through the crisis, the unemployment level in Rochford reached a point that it's not reached in quite a long time. And I'm just wondering if, as a district, and I can't speak for Castle Point, I was kind of focusing on the Rochford data, but certainly in Rochford, that data was quite exceptional. We've not had that kind of level of unemployment before, and maybe that feeds into people not wanting to accept help, not wanting to accept food parcels, because actually, as a district, we've not been in that position before, whereas other parts of the county have been in that position before. And Mike Gogarty's data, I thought, was actually quite interesting in how it kind of showed where historically there's been high levels of unemployment, and Tendring was specifically mentioned, and yet now we've got that same issue to some extent within Rochford, and I think that's where the community struggles to adapt to being in a very different place to where it has been before.
And how do you think that's going to impact on what the community needs from not only its statutory services but also its voluntary services, and thinking about that partnership element? Hello.
Sorry, Sarah, I think it's the rise in the need of food banks, and future work has got to be, food banks are not the norm, food banks are not acceptable.
Yeah.
You know, that's continuing. So what can we do to build people through budgeting, through apprenticeships, through offering them volunteering and upskilling, so that they do have the ability to find work when it's available? And that what can we do to support them, either with man in the pan, cooking courses, whatever it takes to be able to make them not reliant on food banks, but use the food banks to identify those families who then go on to, you know, so that we can support them in a different way. Because the rise in food banks and the mutual aid groups that set up during the pandemic to be able to distribute food were extreme, not just in this county but nationwide. So I think that's something we can focus on. But just to go back to what Scott and Julian and Mike have said, we could not have made the success of the hub and helped the people if it wasn't a partnership approach. We couldn't have done it on our own. That's the point. And I think that is one of the key learnings, is that partnership is the strength.
So in terms of thinking about the strategy, then in terms of the strategy, the one of the essential tenets of community resilience is partnership working. Is that, would you agree with that?
I think so. And also I think, Sarah, what we didn't do, we did bring, there wasn't any stronger person at the table, which is really quite helpful. There wasn't. So RDC didn't call the shots. I didn't call the shots. You know, the churches together didn't call. We didn't have a. There was just a mutual. We were all at the same level at the table, okay? And actually, for once, it wasn't about what we could gain, because we were trying to deal with a crisis. Nobody's agenda was a priority, and actually, that was very apparent. I felt that we weren't trying to sort of say, well, I've got to tick this box back in my organisation, and that was very. Very aware, very obvious. And also, what Victoria said, I think Victoria is a really, really key thing, Victoria. You know, one thing we're looking at here is, out of the, obviously we see the data on a daily basis, is we're looking at, okay, well, how do we train people in, we're doing a job bank probably here at the main centre, we're probably going to do CAPS, so money management. So how can we help people out of this crisis? And actually a lot of the older people as well, we're looking to do an older person thing at the centre, which we've never done before. We're looking to say, well, actually, how do we do some skill sets, basic cookery? I used to be a chef before I was a vicar, but how do we do basic cookery where you can make a meal out of ingredients of £2? How can you budget a bit better than you do? So what we're looking at is to try and say, going forward, is like, what are the needs that came up, and why do people go to the food bank? What we can do to try and stop them from doing that, giving food in their basket, to help with that. We're looking to probably, we're working with the food bank here already, but we're looking to put a program together of probably financial stuff, and budgeting, how to cook on a budget, how to cook on a budget, how to live on a budget, and we're going to try and put a package together to deliver on some of that. And that's come out of the coronavirus helpline. All that has come out of that. So actually, we're giving people a tool. Now, will they come to that? I think they will. Because that's probably less, that's easier for some people to do than go to the food bank, because quite a few people find that hard. Lindsay had a hand up. Lindsay?
And can I ask a question around the relationship with health services throughout COVID? And just thinking about, you know, obviously CAVs have had a really pivotal role through their social prescribers in terms of linking the primary care offer with the voluntary offer and what people need. But going forward, do you think that there's an opportunity above and beyond social prescribers to bring health and the kind of broader community partners together? Because, you know, identifying people who might have specific needs or who might be particularly vulnerable, who perhaps, as you yourselves said right at the beginning, that maybe don't feel like they can feel comfortable accessing services. Is there a kind of in-reach element or some kind of shared list of vulnerable people that could work, bring voluntary and health services together and social services to work more seamlessly?
One thing that I would have liked to have done, Sarah, which I can't have done, my wife now works as a GP in Pitsea, but she used to be at Audley Mills. One thing I would have loved to have done is I would have loved to, within our sort of radio in our district, I would love to have got the partners from our, you know, get the GPs together. Some of the partners, and I spoke to my wife about it extensively, and she said, well, you can come and speak to us as partners in Pitsea, but we're a bit they're out of Rochford. But I think that would have been a really helpful thing, and I think that would have been really helpful for us to do in our learning, you know, in the document I've got about our learning, certainly from an RDC perspective, to actually see how we could have linked in somehow with, you know, the GPs or even the partners of some of the big GP practices, and actually had a dialogue and conversation with them, because I think it would be beneficial both sides. And that's something about our learning, and it's something that we want to try and explore a little bit in the future.
I'm just gonna, on that note, I'm going to just share a slide with you from further down the deck, because I realised we kind of started off talking about the data, but actually we've talked about more broadly. But I want to share this with you. Can you see that screen.
Not at the moment.
Is it coming? Oh, hang on. Maybe I'm not sharing my screen. Am I sharing my screen?
You're not sharing the screen at the moment, no.
Hang on. I'm sharing the wrong screen. That's what I'm doing.
Oh yeah.
Is it there?
Yeah. Yeah.
Okay. So this is something that's come out of conversations with a variety of partners across South East Essex, EPA, our community health provider, and primary care, and other kind of partners. And this is a kind of vision really for locality leadership, and around bringing together and really being very inclusive around having leaders from the localities, so community organisations such as yourself, alongside residents and faith leaders, alongside health, social care, mental health leaders, to create a kind of locality leadership function that would kind of direct the strategy and the ways in which partnership, sort of formalise that partnership working really, and get everybody engaged. It would be very, very important that there was, exactly as you described earlier, Scott, that kind of parity of esteem for people who were sitting at the table, so everybody felt like they had an equal voice, and that the needs that they recognised and evidenced in the locality were as important as health needs or social care needs, and recognising that actually what the work that the community sector can do can actually happen more upstream and can prevent some of those crises and urgent care needs happening. And kind of just to reflect that, the slide earlier. So this is a kind of thinking about how we provide support on a kind of locality population level. So thinking about that would be, for example, Benfleet or Canby or Rochford, and that you know, there are people who have the highest needs, which is the complex people who need health and social care, and probably, you know, a whole host of services and support wrapping around them. Maybe some of them are at the end of life. Then there's those people who have ongoing care needs. So those are people who are maybe frail or have a long-term condition or a number of long-term conditions, who need regular interface with their GP or even with hospital services. Then there's urgent care needs. So that's where somebody has a stroke, or somebody has, you know, a health crisis, a health event, or even a social care crisis, and they need a lot of support, but for a short period of time. And the idea is if that urgent care need is met effectively, that they can move back into that bottom population tier, which is where community resilience comes in. So this is about, you know, looking at the assets within a locality that enable a population to stay well. It really focuses on that prevention agenda. So, you know, supporting people to take healthy behaviours, making sure that planning decisions are mindful of health and wellbeing needs, you know, health promoting environments, infrastructures, active travel, for example. Ben's on the call. I'm sure he's got some thoughts around this, but that's where this element of the health and wellbeing strategy really focuses, is on that whole population, asset-based prevention, and really creating healthy environments for people to lead healthy lives within. And the idea would be that leadership model could help to drive this and make sure that all partners are working together, so that when someone tips from whole population through an urgent care need, and may in fact then need ongoing care needs, that breadth of need can be met, not just by health, but also by social care, but also by you know, the voluntary sector, the community, wrapping around somebody, support, you know, promoting good neighbours, all of those things that I know that you do already, but at the moment some of those things are happening in isolation, in silos, and trying to bring that together so that you as a community organisation are well hooked into your local GP surgeries and the primary care network.
Yes,
and Hello, is everything all right?
Yes, it's fine. Sorry.
No, it's okay. I thought I'd said something really controversial, and I thought, what have I done? What have I said? So I'd be really keen to get your thoughts on that. I'm going to stop sharing my screen so I can see you all again. Any thoughts on that kind of model and how you feel like you could play a part to bring that into being?
I have some, but I want other people to speak, so I've spoken too much. I do have some, but others?
I can't remember.
Can you hear me? I'm happy to come in. I mean, I think from my perspective, I think that you know, one of the things that we've learned in Castle Point is about that sort of that specialism a little bit. I think of support, and I think I alluded to it in the presentation about how, you know, most of the community organisations out there can actually turn their hands to most things. You know, extremely adaptable, extremely resilient, you know, and be able to sort of react quickly in a crisis. And I think that's what we saw happen in Castle Point. I think there is something around the coordination. You know, there's an understanding of what that offer is and which organisations are best placed to provide which support. But I think an understanding of that and a coordination of that, and, you know, and where that coordination takes place, I think is probably something that we do need to sort of almost get to the bottom of. You know, is the GP surgery the place where actually most people first go when they want to talk to somebody? Is it a different organisation? Is it CAVS? Is it RAVS? You know, that coordinating role, should that very much sit with them? These are only sort of thoughts, you know, but I think they're important to get to the bottom of, actually. And I think a lot of the time it is about that navigating through the system, actually. You know, I know that we have sort of, you know, expressions around sort of care navigation, etc., etc. And I think there is an element here, actually, you know, community sector navigation, for want of a better expression. I think just in terms of being able to sort of understand what that local offer is, and the organisations within that local offer being able to understand what each other does. And I think that's where the partnership thing came in really, really strongly, actually. And that's where, you know, perhaps not initially, but certainly later on, you know, it's in the sort of in the time period since lockdown, there was a lot more communication, I think, between the community and voluntary organisations, talking with each other and getting to know each other a little bit better. I think that was really, really powerful.
Yeah. Thank you.
Yeah, thank you. Yeah, I would agree with everything that's already been said, and also I keep losing my earpiece. Sorry. And also, it's not just health. I think it's where, as you say, wherever anybody goes to get some support. You know, with families, it might be at the school. With people with preschoolers, it might be at the children's centre or family hub, as they're known now. So it could be any of those organisations or the voluntary ones. I think in the past, working not just for the Mega Centre but for other charities, as I have done in my career, I think there's also been an element of I think, can we rely on smaller organisations to always be there? But I think the partnership that we have now is stronger than that. As you say, as a partnership, we're really strong and only getting stronger. So the partnership is what is able to support the community rather than individual organisations within that. But as I say, I think it's not just GPs, it's wherever anybody goes to get some support, even if it's a poster on the wall in the library or something, just where somebody thinks that they might be able to get a listening ear or just a bit of signposting. So
Julie, I think that point that you make about sustainability and resilience of community offers absolutely key. I kind of like to open that up to Victoria and Lindsay, because, you know, obviously as a association of voluntary sector, the voluntary services, you have I suppose a role to play in that sustainability and resilience of the community sector. I just wondered whether you had any thoughts about that, really.
I think the point is it's about getting the message out to places where people go. If people, you know, the point that Scott made earlier was the point that people don't want the help, people don't want to ask for the help, but people needed the help. So do we put leaflets in taxis? Do we put something in the local hairdressers? Do we, I don't know, get people to put posters in tea shop, whatever, places where people go, where they will get the information but they won't have to actually find it or make it more obvious. I don't think yes, but people usually only approach voluntary services when they're either in crisis or they already know about us. Because one of the things Rav picked up on was during the pandemic, which has been a real positive for us. Oh, I didn't know you were here. I didn't know you did that. What was the other thing? I didn't realise you were so small. You know, was another brilliant one. But yes, I know. So the point is that I don't think it's just about using voluntary services. The resilience for the community, Sarah, has to come from a commercial element as well now.
Okay.
Yeah, but
needs are so different, aren't they? And from our experience across the board, someone has to be ready to accept help. So if they've got mental capacity, and even though all of us can know or think what help they need, they have to be ready to accept it. And I think what we've got to be mindful of is not having too much information out in the community and get confused. You know, I think the good news is with the PCN Wellbeing Link coordinators is that, you know, part of their role is linking in with all the different partner agencies, and as a CVS, we've already got a membership base anyway. You know, a strength of ours is that, you know, if we can't personally help, we know someone who can. And we all, you know, we sit on enough different boards to know that if we come across something we wasn't sure of or couldn't find an agency, then there's always somebody to ask. You know, I think it's from COVID perspective, and dare I say a generational thing, but yeah, in general, the older generation, I think the way they were brought up is they're very appreciative of the offering. So, you know, some of them needed a bit of encouragement of, you know, don't worry about that, we're here to support you. You know, if you need that food, we'll get it for you. I'm very, very grateful. You know, I don't want to generalise, but the younger generation have a totally different attitude. I'm not saying that all the older generation were the same, because I know we come across a few that, you know, it's almost, I deserve it. I've paid my money and I deserve this help. So, you know, I think the strength is our partnership work, the knowledge that we have, the skills that everybody has, and, you know, the collaborative working. I think we're already doing it. And I know from our point of view, we are already linking with the educational settings. But I think this goes back to not only individual people accepting help, but also different partner agencies remembering the agencies are there to help. I think everybody becomes so busy quite naturally, and sometimes they do know you're all available and we're all available, but they're so, you know, drawn into that moment of what they're doing, and they forget, oh, actually I can signpost them to whomever. Because I think, like Victoria, I find it quite interesting when people say, oh, I didn't know you were there. You think, really? Everybody, you know, generally
really
that are in the community. And I remember a few of our clients saying, oh, you're Cabs, are you? I've heard about it.
Yeah, and I suppose that's one of the silver linings of COVID, isn't it? Is that everybody's profile has been raised slightly. Hello.
We've got 5 minutes left, by the way.
I know, I saw that, and I was just about to go on, Scott, please.
Just to say, Julie, I don't know if we should share them with our secrets with this group, but I feel we should a little bit. You know, we are seriously considering as a mega centre, okay, some of you will know us, we do soft play and laser, but Victoria will know a bit about this because we've had conversations. Is actually, we're mortgage free now, is trying to, within our DC district, trying to make this centre a community hub. Out of the back of coronavirus. So what we would have is voluntary sector people having offices here, us having offices here, CGC having, you know, or CCG, and actually having a place with a coffee shop and a place where people can just come, right? So if you come into this space, there's enough facilities to hire out. So all those organisations could hire out the facilities to use, but there's also offices, so that we have a realistic coalition of partnership together. Now that's just a crazy thought, but it's certainly something that we are seriously considering. Is that we've been here for 27 years, we've done laser and soft play, and we've had an impact in our charity, but might say that maybe those times have had their day, and the next thing is out of the back of COVID is to have, you know, dare I say it, we might even be speaking to a GP surgery, to have a surgery here as well. You know, just having that whole thing that you have a hub where we're all together. And I think that's come out of COVID for us, and it's come out of partnership for us. Now, how that will work. So do think of us, because we're having those really crazy ideas. But I think there's a lot of benefit. I've seen it working in Switzerland, and I've seen it working in South America, because the resources say it has to work, because we all can't rent our own facilities. Now, I think we're coming to that stage a little bit here, so it's something we're exploring.
That is music to my ears.
Well, let's have a conversation, because we want to make it happen. Because I used to work in South America, and we couldn't do it there because people they were too poor for us all to have our own facilities. And so actually what we did is we all worked together in the same building in partnership. And actually what it did, it radically changed the community in which we worked in. Oh, very, very different than Raleigh and Rochester District, very different.
Yeah.
The principles are really key. And I think COVID has told us, if COVID's taught us some things, I think it's teaching us as a mega centre, maybe there's a new way of doing what we do.
Yeah. Thank you, Scott. That's really interesting. I'm just going to share my screen before we have to finish. So this is,
really
we've got...
Go on, we've got 56 seconds. Share
Yeah,
it.
I think.
Share it for 56 seconds. Oh, she gone? Elizabeth, did you just get rid of Sarah?
I didn't. I was about to say